Welcome to today's explainer. To kick things off, we really have to ask a fundamental, almost terrifying question. What actually happens when the body's finely tuned, perfect hydraulic system starts to fail? I mean, think of your circulatory system as this incredibly intricate plumbing network. When it works, it is an absolute marvel of engineering. But when it breaks down, the consequences are immediate and they are profound. So today, we're diving straight into the fascinating, high-stakes world of hemodynamic disorders. We are taking dense medical pathology and translating it into the thrilling story of our internal plumbing. It's a story of pressures, physical barriers, and the incredibly razor-thin margins that keep us alive every single day. Here is our roadmap for this explainer. We'll start with edema, looking at when fluids escape. Then move to congestion, which is basically vascular traffic jams. From there, we tackle thrombosis, the clotting conundrum, followed by embolism, those rogue moving blockages. And finally, we'll cover shock, total systemic collapse. So what exactly are we talking about here? Fundamentally, a hemodynamic disorder is a disruption of equilibrium. Under normal, healthy conditions, your blood stays fluid and goes exactly where it needs to go, right? These disorders occur when that brilliant physiological balance simply breaks down. Let's jump right into our first stop, Section 1, edema, when fluids escape. It's crazy to think about, but our normal everyday tissue dryness actually relies on a continuous, invisible tug of war. On one side, you have hydrostatic pressure, driven by the pump of the heart, literally pushing fluid out of the vessels. On the other side, plasma osmotic pressure, driven primarily by a protein called albumin, is pulling that fluid back in. If hydrostatic pressure spikes, or if osmotic pressure drops, that balance is lost. Fluid escapes into the surrounding tissues. And that, my friends, is exactly what edema is. Now, usually, any tiny leaks are quickly cleaned up by your body's built-in backup drainage system, the lymphatic vessels. But what happens if that backup drainage system fails entirely? Well, the fluid has nowhere to go. This can happen from physical trauma or invasive tumors physically blocking the path. It can even be triggered by severe parasitic infections, like filariasis, which causes massive fibrotic blockages in the lymphatic channels. And the real-world stakes of these failures are absolutely stark. On one hand, you have severe localized swelling, known as elephantiasis, driven by that massive lymphatic obstruction. On the other hand, there's classic pitting edema. This is where excess fluid pools under the skin and literally leaves a lasting depression when you press on it. It's a huge hallmark of systemic issues like congestive heart failure. All right, moving on from escaping fluids, we hit Section 2, congestion, vascular traffic jams. Now, this is where it gets super interesting. Both hyperemia and congestion mean there's extra blood pooling in your tissues, but for completely opposite reasons. Hyperemia is an active, healthy influx of bright red, highly oxygenated blood. Congestion, however, is a passive and highly dangerous backup. The blood simply can't drain out, leading to a stagnant, sluggish pool of blue, deoxygenated blood. We call that cyanosis. And when that passive congestion just hangs around and becomes chronic, your organs really begin to suffer. Take the liver, for example. When blood backs up here chronically, the organ develops this incredibly striking appearance, famously called a nutmeg liver. The dark, depressed spots are actually regions of dying centrilobular cells that are quite literally starving for oxygen, and they contrast really sharply against the surrounding healthy tan tissue. If we zoom way into the microscopic level, the why behind that nutmeg pattern becomes super clear. That sluggish, backed-up blood creates persistent hypoxia. It is suffocating the local liver cells, leading directly to hemorrhage and centrilobular necrosis. That brings us to our third chapter, thrombosis, the clotting conundrum. Hemostasis, which is the body's ability to clot a bleed, is an incredible inbuilt security system. But it can be hijacked. The start of a dangerous, inappropriate clot is defined by something called Virchow's triad. It requires one or more of three specific triggers: an injury to the endothelial wall of the blood vessel, altered blood flow like sluggish stasis or violent turbulence, or hypercoagulability, where the blood itself is just chemically primed to clot way too easily. Once that trigger is pulled, this process follows a highly specific, rapid-fire sequence. First, platelets adhere directly to the newly exposed, damaged vessel wall. Second, they undergo a release reaction, firing off chemical signals. And finally, those signals command aggressive aggregation, recruiting more and more platelets to build a solid temporary plug. It goes from fluid to solid in a matter of moments. Now, these solid masses can form pretty much anywhere in the body, but deep vein thrombosis, or DVT, is a prime example of why this is so terrifying. DVTs occur in the sluggish, slow flow of the large leg veins. And here's the crazy part. Up to half of them are completely asymptomatic because other veins just compensate for the blockage. The patient feels entirely fine, but there is a massive clot just waiting to break loose. Which tees us up perfectly for Section 4. Embolism rogue moving blockages. Think of an embolus as an unguided missile in your bloodstream. While 99% of the time these are dislodged blood clots, like a DVT that broke free, other bizarre internal debris can actually clog the system too. We're talking fat droplets from a severely broken bone, nitrogen bubbles in a scuba diver with decompression sickness, or even amniotic fluid debris entering maternal circulation. When one of these rogue missiles finally gets stuck in a vessel too small to pass, the downstream tissue starves and dies. That is an infarct. And anatomy completely dictates how this plays out. Loose tissues or organs with a dual blood supply, like the lungs, pull with blood to create a bloody red infarct. But dense, solid organs with only one route for blood supply, like the heart, suffer a pale, bloodless, white infarct. Finally, we reach the worst-case scenario. Section 5. Shock. Total systemic collapse. Now, shock isn't just being startled. Medically, it is a lethal drop in systemic perfusion, and it generally stems from 3 primary failures. Cardiogenic shock is when the pump itself, the heart, fails. Hypovolemic shock happens when the actual fluid drains away, like in massive trauma or hemorrhage. And septic shock is a complex nightmare where a massive infection triggers an immune overreaction, dilating all the body's pipes at once and causing blood pressure to just absolutely bottom out. This whole process follows a terrifying chronological escalation. It kicks off in the compensatory stage. Your heart races, your vessels constrict, trying desperately to fix the pressure drop. But if it's uncorrected, it spirals into the progressive stage, marked by widespread tissue suffocation and lactic acidosis. And finally, it plunges into the irreversible stage. The mitochondria fail entirely. At this point, even if you magically restore blood flow, the cells are already gone. At this terminal point, severe oxygen starvation and vicious microvascular clotting trigger a rapid-fire sequence of multi-organ failure. The kidneys shut down, the lungs fill with fluid and fail in acute respiratory distress syndrome, the heart and liver rapidly deteriorate. The entire internal network has essentially flatlined. Having traced this incredible journey together, from a tiny minor fluid leak in a capillary all the way down to total systemic collapse, we're left with a pretty profound realization. Your body's hemostasis is an absolute miracle of engineering. But considering the massive, complex forces constantly at play, how will you view the razor-thin line between your body's perfect internal balance and catastrophic failure tomorrow? Think about that for a second the next time you feel your pulse. Thanks for joining me on this explainer. Keep learning and keep asking questions.